instead of around particular courses, they're around certain content areas and competencies. And that's different than most other places, and it's helpful as you take students through to help them understand how it's different. And the electronic portfolio is also fairly unique in how that's used to track and demonstrate the competencies. So those are kind of points that you want to make sure that applicants or others who are visiting are aware of. These are the target areas that we look at: curiosity, competence, contextual understanding. These are the things that are the goals that we hope students have when they go through the Hallmarks program. So just, again, I don't expect you to be able to recite them, but just to have some broad understanding of what we're trying to accomplish. And if someone asks me, well, how is that different than any other school? Other schools are class-based, right, where you take a specific class in a particular area. This is a competency-based. We wanted you to have general areas that you're knowledgeable about, and you demonstrate that knowledge through the artifacts that you post in your e-portfolio. So it's different. And so highlighting that difference is really useful. The College of Science, Health, and Liberal Arts has 3 divisions, and it's not hard to remember which ones they are: science, health, and liberal arts, right? The liberal arts division does a lot of courses that are in the Hallmarks curriculum, but they also offer 3 majors. 1 is in communication, 2 is in law and society, and 3 in environmental sustainability. Now, we have a couple of environmental programs here. The thing that's different about environmental sustainability, it's a policy-based program instead of a science-based program. So we have another one in another college that is a little bit different, has a little different focus, but this one's focused around environmental policy. Law and society has a political science component to it, and it also has as a good program for the students who are considering pre-law. So if someone says, do you have a pre-law program, most of those students would get that preparation in the law and society program, right? So even though it doesn't say pre-law, that's a place for students. If you got questions, just jump in, don't wait till the end. Okay? Undergraduate research, again, talking about research opportunities. I won't dwell too much on that because I want to spend the little time we have going over all the programs that we have. So we have the undergraduate science programs: biology, biochemistry, biopsychology, chemistry, health science, pre-medicine, and psychology. Can anybody tell me what the difference is between the health science and pre-med? Right? That's a question that a family might ask or a student might ask. Well, you have health science and pre-med, what's the difference? The health science majors aren't required to take calculus, calculus-based physics, or organic chemistry. Pre-med takes those courses. So that's the differentiator. Why is that important? To get into med school, you have to have those courses, right? So that's why we separate them out. So if a student is saying, well, I'm thinking I'm interested in going into a medical school, then they should be in the pre-med curriculum. If a student is interested, you have a question?
I was going to say, does health science have to take biochem?
Health science, they take a course, it matters which track in the health sciences. We have a combined organic biochemistry course. Yeah. It's more of a topics course that has a combination of both, but it's not the year of organic chemistry that the students take in pre-med. So it's more of a survey course that has topics in general chemistry, topics in organic chemistry, and topics in biochemistry, but it's not the general organic chemistry that the medical schools require. Yeah. So that wouldn't be accepted as a substitute if you're planning to end up in medical school.
So okay.
Okay? So how does this impact you? If, as you're touring people through, they may ask, we will have a medical schools in July, right? We will have a lot of people here who are going to be interested in going to medical school because we will have one as part of our university. And so the question will come up, well, what is pre-med? Do you have a pre-med? Yes, we do. We have a program designed specifically for students who want to go to medical school or dental school. It's the same track. And we also have a program for students who are interested in all the other health science programs as well. We have some other programs that are particularly designed for some of the other professions, which we'll talk about, but those are the ones you get, kind of the big general ones. And there are a lot of students that go into those tracks. So health science and pre-med, so be aware of those. Biology, biochemistry, again, most of these are pretty self-explanatory. The graduate programs, again, just to be aware that we have these programs. We have a master's degree in athletic training, a master's degree in community and trauma counseling, which has the option starting this year to also add an art therapy specialization. So those students can become licensed professional counselors and art therapists. We have a master's degree in disaster medicine and management. We have a master's degree in midwifery, and we have it in 2 different tracks. So students can come here and become a midwife. If they're a nurse, become a certified nurse midwife, or if they're not a nurse, they can do a different track and become a certified midwife. Same curriculum. And starting in September, we will also have the doctorate in midwifery. So students who have completed one of these programs can go on to get a doctorate in midwifery. Occupational therapy, we have a master's degree here in occupational therapy, and we have been offering a doctoral program in occupational therapy, which is designed for those students who already are occupational therapists who want to get a doctorate. But since we are merging with Thomas Jefferson and they have the same program, that doctorate part is going to be consolidated, and so that program will be offered on that campus. So we will complete the students that we have, but the doctoral program will only be offered at the Jefferson campus because it's not that big of a program that we could have it at 2 different places. So just so you're aware, if someone says, I want to be an occupational therapist, we have a master's program, but we also have a doctoral program. It'll be offered at our other campus because they're not going to be 2 separate colleges. Everyone understands that, right? One university, we're going to have one name. They're all going to be just at 2 different campuses. Same university. Okay. Physician assistant, so we have the master's degree in the physician assistant program. We have it here on this campus, and we also have an option in New Jersey. So we have a satellite campus in New Jersey where we offer the physician assistant program. So students can take it here or take it in New Jersey. We get a fair number of students who are from New Jersey who come to the campus who might be interested in the fact that we not only do we offer it here, but we also have a New Jersey option.
Where is the New Jersey campus?
Well, right now it's in Atlantic City. That may shift, but right now, as of today, it's in Atlantic City. Global opportunities, right? So as undergraduates, you have an opportunity for a semester abroad through Costa Rica, or we're members of the Global Brigades, which allows students to have 1-week experiences. Anybody do that yet? Here? Okay. And where'd you go?
Honduras.
Honduras, right? So we're part of the Global Brigades. You can do that as an undergrad. You can also do it as a graduate and have a little different experience. So we do have a chapter of the Global Brigades here. And so we have those experiences available to undergrads as well as grad students, and we have the opportunity to do a health-related international study abroad. Oops. We have a new health science building slated to begin construction this May, and it will be done in about 1.5 years. And so as you're touring people around, and especially as you walk them through Hayward, you can let them know that adjacent to Hayward, facing Henry, between Hayward and Henry, there's going to be a new health science building. It'll be connected to Hayward. There'll be, right now where the Nexus classroom is, when you first walk in, that room is going to disappear, and that'll be a corridor to take you into the new building on each of the floors. And so it's a new health science building, and we expect it to be ready a year from this coming January, that students will be in there. Okay. Any questions about that? Okay. Clinical labs. So we have a cadaver lab here on campus. You're not gonna be touring people through it, right? And it's not a common thing to have a cadaver lab on campus, but we have one. We also have one at our campus in New Jersey, and we also have a very big one at our campus in Center City at TJU. So we actually have 3 cadaver labs, which is really an unusual thing to have. And so we have a lot of resources around cadaver labs. We have a simulation here, the Ronson Lab. We have a simulation lab here in Hayward, which has all sorts of what's called high fidelity simulators. Those are complex computer-driven simulators called high fidelity simulators. If someone's looking around at other places, they may use that term, high fidelity. That means computer directed simulation. We have that here, but fortunately in our new partnership, TJU has a whole 5-story building dedicated to simulation. So there are even more resources that we have that students will have access to. Oops, sorry.
What kind of simulations do they do?
All sorts of simulations. So they can simulate patients having all sorts of abnormal heart rhythms, breathing difficulties. We have birthing simulation, so you can practice delivering a baby. All sorts of different types of things. There's equipment that you can practice starting IVs on, practice putting endotracheal tubes down to help them breathe. So there are all sorts of simulators. Some of them are low fidelity, not very complicated, just an arm, and some of them are very complicated, costing over $100,000, that are computer driven. So it's a great opportunity that students have. We have them here, we have them at the New Jersey campus, and we have a building committed to it in Center City now, starting after the merger. This is the merger with TJU. Have we talked about it at all? So this will be a real interesting question as that people will have if they're interested in the health sciences, right? So people interested in other areas, they may want to ask questions. Well, how will that change the culture? Now that you're part of a large enterprise. TJU is a big enterprise, right? There are 13 hospitals that are part of Thomas Jefferson University. Hospitals here in Pennsylvania and in New Jersey. It's a very large network. So it's an enormous opportunity and provides great resources for anyone who wants to study health sciences. There aren't a lot of places where you can get that. And so understanding what that means to students who are coming here to be pre-med or any of the health sciences, it's really a distinctive feature. And you should be comfortable with that, understanding what that means. Any questions about TJU and how it impacts students that are looking here? Okay. Track-up programs. Track-up programs are how we connect the undergraduate experience with the graduate programs that we have here in the health sciences. So we currently have 4 that are track-to programs that we offer on this campus. That's where they call them 3+2 options, where a student does 3 years as an undergrad, and then 2 years in the grad program. And their senior year is an overlap year. So your 4th year, your senior year as an undergrad, overlaps with your 1st year in the graduate program. And why is that important and valuable? That means that's 1 less year you have to spend in school. So normally if you weren't in this program, you would do 4 years and then have a 2-year requirement. By being in the 3+2, you actually go down from 6 years total to 5 years. So it really saves students time and saves students and their families money. So which is one of the things that makes those programs attractive. So we offer that for the physician assistant program, the occupational therapy program, the community and trauma counseling program, and the athletic training program. Okay? It's something that's anybody here in one of those options? Yeah, somebody in the back. Okay. So it's a very popular option. A lot of students, a lot of applicants come here interested in those options, and they're going to expand greatly, and you'll see in just a little bit through the merger. But you need to be aware of if someone asks, oh, do you have 3+2s? Do you have articulated programs? These are the programs in the health sciences that we do. Okay? Any questions about it? So other articulated programs. These are programs that we have with other universities, not including Thomas Jefferson. So what these are, where students can come here, complete their undergraduate education, and move directly into a graduate health profession. So let's walk through them quickly. So if you want to go to medical school, we have articulation agreements where students come in as freshmen now. They've already been pre-qualified to go directly into medical school. Lake Erie College of Osteopathic Medicine, Philadelphia College of Osteopathic Medicine, they are already targeted and have their seats guaranteed, and all they have to do is meet certain grade benchmarks to progress through their undergraduate education directly into medical school. So we have that program. If as people come in and tour around, if they ask about medical school, and there are going to be a lot of questions about medical school, you should just know we have these. We have a similar program like that with dentistry, with Temple and LECOM, chiropractic medicine, veterinary medicine, pharmacy, and physical therapy. So these are all ways where students can come in and get involved in a health science, and if we don't offer the graduate program, it's articulated with the program so they can have a seamless transfer from here into a new health science career. And now these are also expanding with Jefferson. So we are now also offering these with Jefferson. Probably the one that you'll see most of is nursing. We have a 2+2 with nursing. So we now have a nursing program. Students can come here, do their first 2 years here, where they're pre-nursing work, and which is the arts and sciences, and then the last 2 years they'll do it at the downtown campus, and they'll get a bachelor's degree in nursing. So we know there are many, many students that have been interested in this program, and you'll likely have the opportunity to tour students through. That's probably one of the most popular of those on that list. So just so you know, we do have it. If someone says we have a nursing program, yes, we do. And we don't, actually we do. We actually have admitted students now who are in this program. So we do have a way to go directly into nursing. Any questions about that? And so we offer similar types of arrangements with pharmacy. We have a 3+4 now with Jefferson, 3 years undergrad, 4 years grad. You get a doctorate in pharmacy, radiologic sciences, laboratory medicine, public health. All of these options are available. So, it's a place where if you want to go into healthcare, we have a track where you can come in as an undergrad and have a seamless transition into a healthcare track. I think we're just about done. We have this office called Pre-Professional Programs in Medicine and Health now. It started this past September. And what that does, it works with students. It provides counseling, mentoring, advising, and tracking of students who come into the health sciences to ensure that they're successful. If a student is struggling, there's support services there, there are advising services. There's a whole host of programs designed to support students so when they come into a health science, they are monitored, tracked, and supported, and making sure if it turns out they're not in the one that they've always wanted, they thought, oh, I always want to be an occupational therapist, and you change your mind. Well, there's other options that are created for them. So we do have this office, and you should be aware of it.
Who runs that?
We have 2 faculty members, Dr. Kundell and Amy Baker,
Okay.
and it's reports up through my office, to the dean's office. And then, so kind of the bullet points, if you're, health science students, why Philly U? Why should you be here, right? It's a great learning environment. You're in Philadelphia, but you don't know you're in Philadelphia. So I think people are really surprised to see how nice of a campus it is. It's collaborative, real-world professional education infused with the liberal arts, lots of track-up programs, global opportunities, and all of this gets bigger and better through the merger with TJU. Okay? So snapshot, everything you ever want to know about College of Science, Health, and Liberal Arts, but we're afraid to ask. Questions? It's a quiet group, it's just like the post-lunch